Well, the World Health Organization is telling countries to prepare for the coronavirus to spread. But what exactly does that mean? Let's discuss with Lieutenant Colonel Hel Kampfer. Hel, thanks for joining us. Hel, you in fact led a team for U.S. Northern Command on pandemic preparedness. Now, last week and the week before, major U.S. military commands were told to plan for a pandemic outbreak. So what does that actually mean? What does that mean in terms of logistics and things needing to happen?
Well, we went through a number of things with U.S. Northern Command. We did the same thing with a number of military commands around the world. This was back in the middle of the last decade. We'd had SARS, and then right afterwards we had H5N1. And this was the first time that this North American command was getting ready for what was essentially going to be a potential pandemic across the United States. We had to look at a lot of civil military capabilities because, frankly, the Center for Disease Control has limited capabilities. Even public health, as impressive as it is in the U.S., when you talk about pandemic, we simply run out of people, we run out of first responders, and it's inevitable it becomes a civil military issue. And that's what we were training U.S. Northern Command and other commands to basically set up these joint task forces working civil military pandemic response preparedness activities.
So what would that mean? What is a response activity, for example?
Well, amongst other things, I know Dr. Gupta mentioned quarantines. Well, quarantines, if properly managed, do kind of work. They're not perfect. They're not a panacea. And the rules of force, how you enforce quarantine, that's a whole other issue. We get doctors and lawyers involved. But it does work. Also, social distancing. Basically, all these common sense things, beyond just washing your hands and making sure that you don't touch your face after touching surfaces and things like that. Putting some distance between people to reduce the amount of transmissibility of the virus itself. And there's a lot of things there which really get into ergonomics in terms of how people move, where you position them, how you deliver supplies, things like that. Really it's a management, it's an organizational issue, but it's also a social engineering issue, if you will, in a large sense, in terms of trying to decrease the amount of spread, if you will, of the virus.
Right. Okay, well, the World Health Organization has been telling countries to prepare, but it hasn't gone so far as to call it a pandemic yet. Why? What are the criteria of a pandemic, and why do you think the World Health Organization is reluctant to use that term so far?
Pandemic is based on certain criteria they have, the number of places it shows up, the number of people who are infected. They're pretty much on the threshold. In fact, if they were to call it a pandemic today, I think they'd be well within the spectrum of what a pandemic represents. Usually, epidemic, you get to a certain point where you look at the number of people who have been infected, and then you look at how spread out it is in terms of regions. Now, right now, it's on 5 continents. If you start seeing more outbreaks in Europe, certainly much more in North America, I think you're going to see a pandemic get put on it. But one of the problems we're having is reporting. For example, in Indonesia, there's not a lot of reporting. Indonesia is a very populated country.
Right.
Part of that is a lack of test kits. And if you can't test, you can't confirm if it's actually COVID-19 or not. And some of the test kits that were used overseas weren't very accurate. In fact, one kit that was being used had about a 45% false negative rate. So there's a lot of challenges in just the science and basically the reporting to help with the management process.
Very quickly, Hel, what can people at home do to prepare?
Well, common sense stuff. Wash your hands, wash your hands, wash your hands, all right? If you sneeze, if you rub your nose, anything like that, wash your hands. Try to avoid shaking hands. Fist bumps, elbow bumps are always good ideas. Actually in the Far East, a bow works very well because there's not physical contact to transmissibility. Also, when you're touching surfaces, wash your hands. I just talked to an expert on this issue today in terms of stuff, about a 70% solution. So.
All right. Keep safe personal distance, fist bumps and elbow bumps. Got it. Hel, thank you so much. Hel Kampfer, appreciate it.